The following program is brought to you by Naleo TV, the People's Platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
Walina mai kako. Welcome to another episode of Let's Talk Healthcare Hawaii, where we help our community understand the important healthcare options that can improve your quality of life. In our last episode, we focused on the benefits of signing up early for palliative care, a healthcare program now offered by MedQuest as an included benefit for all members statewide. Yet, most people don't even know what palliative care is. We explored the powerful benefits of receiving palliative care early along the path of living with a serious illness. Sadly, many in our island communities are living with conditions like cancer, COPD, congestive heart failure, and kidney or liver disease, and have no idea that palliative care can make a positive difference in how you and your caregiver feel each day. For the most part, it's the emotional and psychological support that gets overlooked in healthcare, yet is so essential to the overall care one needs. With palliative care, a holistic approach ensures both patients and their families feel more prepared and supported on their individual healthcare journeys. In this episode, we'll discuss the importance of having your own palliative care team advocate. Palliative care teams advocate for what matters most to you, the patient, and help both you and your caregiver understand complex medical information, ask the right questions, help you make informed choices that align with your values, goals, and wishes. The palliative care team is also there to coordinate the care and reduce the stress for the caregiver too. Whether you're living with a serious illness or caring for a loved one, that is, join me on this episode of Let's Talk Healthcare Hawaii. On today's episode of Let's Talk Healthcare Hawaii, I'm honored to introduce a very special guest. She is just 23 years old, but has faced more challenges than many of us will in a lifetime. Living with lupus and kidney disease, she knows firsthand how overwhelming and uncertain a serious illness can be, especially at a young age. But through palliative care, she found support, comfort, and a team that truly listened. Today, she's here to bravely share her story. Please join me in welcoming Jenica Xavier to our program. Jenica, welcome so much to the studio with me today. I feel really grateful that you're so courageous and brave to come in and share your story with us. And I can't help but notice that you're so much younger than most of my guests that I have here. Can you tell me a little about yourself?
I'm Jenica. I'm from Micronesia and I came here to go to high school in Waikea.
Okay, great. And so how old are you now?
I am currently 23.
Wow. Okay. So Jenica, can you share a little bit about how it's been to live with lupus and kidney disease?
It's hard, but with the right support, it's going well.
So, people out in the audience may not actually know what lupus is. Do you think you can share with us on, what you believe that illness is?
Lupus is an autoimmune disease. It affects both the body and the mind.
Okay. So in your case, how has it affected you?
For me, it's affected me both bodily.
Okay.
So I started off with having rashes. So they have like a butterfly rash on your face. and then it went to losing my voice. So that's why I'm a little bit soft-spoken.
Yeah.
And then it affected my joints.
Okay. All right. So how old were you when the rash first started?
I was 13.
Okay. So when did you move from Micronesia to Hilo?
Just as I turned 13.
Wow. So right when you changed to when you became 13. Okay. So were there other parts of your body that were affected?
My left hip. So when I walk, sometimes I walk with a limp.
Oh, okay. All right. Anything, because I noticed that you mentioned to me you go to dialysis. So it affected your kidneys directly?
Not directly, but because lupus is not heard of.
Yeah.
So they do a lot of testing, and sometimes they won't give you the right medicine.
Oh.
So I was on a particular medicine, and it affected my kidney. So I ended up going to dialysis
So how often do you go to dialysis?
3 times a week.
Wow. And how long is each session?
Each patient is different, but for me, I go for about 3 hours, 30
3
minutes.
hours, 3 times a week. Wow. How has that affected your life?
I don't have much time to go out, especially on the days that I have dialysis, and sometimes I end up missing out on like major events.
Oh, sure. Yeah. Did you find that you were going to the hospital a lot?
Yes.
Okay. So now you are with Kupu Care, Palliative Care. Yes. So now that you have been receiving palliative care, actually, how long has that been?
About 4 years.
4 years. So you were only 19 when the palliative care team came to your house. How did you learn about palliative care?
I ended up at the hospital again, and my hospital care team suggested Kupu Care, and when they were talking about it, how they offered support, I wanted it, so I introduced it to my parents. They were a bit skeptical, but I told them like just to give it a try to see if we will like it or not.
So tell me, why were they skeptical about it initially?
My mom thought they were sending me to a nursing home.
Oh my goodness. Okay. So your mom had never heard of palliative care before?
No.
All right. So that's pretty common out in our community. Most people don't know about it, which is why having you on the show today is really important, because people, young, old, it doesn't matter their age, they could probably benefit from palliative care as well. So tell me, how has palliative care helped you and supported you, made you feel with this type of support?
So Kupu Care comes with your own caregiver and your own nurse.
Okay, so there's a team that comes to see you.
Yes.
Yeah. So how has that helped and supported you?
Well, they teach you how to manage your medication and how you do your time. And if you have appointments, they also help you with that. They can either come to you to your appointments, or if you have question, anything regards to your appointments, you can ask them later.
Have you ever had the need for the nurse to go with you to the doctor?
No.
Okay, so you've had that. How is it that you keep grounded with your process? Like, are you writing it down? How are you always like able to communicate things that you're going through to your palliative care team?
We always jot everything down, but I'm able to process it because we always have a goal.
Oh, tell me about that. So you always have a goal with every visit that they come to you have a goal?
A goal to do for like the next visit.
Awesome. Okay, give me an example of a goal that you've had.
For example, this New Year's, we both, I had a goal, also my nurse had a goal. And my goal was to make sure I didn't go back to the hospital, get admitted, and then to go a year without having seizures.
Wow. Okay, so how are you doing on the goal?
I didn't do so well at the first one because I did end up at the hospital again by coincidence. But I did accomplish the second one. It's been a year since I had
Wow.
seizures.
That is excellent. That is excellent. Congratulations. Okay, so from the time that you were referred to palliative care, have your visits to the hospital reduced?
Yes.
Like by how much? Like, say if you went 10 times, what would be your norm today?
Usually I would be going every month to the hospital, but I don't do that
Wow.
anymore.
That is great. Would you say that it's because you have palliative care?
Yes.
Wow, that's great. So you see that it's working for you then.
Yes.
Wow, it's actually made a difference in your life. Yeah. How has it been for your caregiver? Who is that?
That would be my dad.
Oh, okay. So do you feel that it's helped him too?
Yes. There are some terms that my doctor would go over that he doesn't understand,
Oh, yeah.
especially when I come and give him information. So Kupu Care will be there for my dad to like break it down to him so he understands better.
Wow, that's great. So he understands. So, and then he's able to give you that support at home.
Yes.
Wow, that's great. So, what are some of the things that your palliative care team does that really makes a difference for you?
They make you feel like home. So you're able to express both mentally and emotionally. So you're able to discuss how you feel, how your treatments were going, or how you're feeling at that day about your illness.
So, like some days you might be feeling a certain emotion, like for example, what?
Sometimes I'll be feeling angry.
Oh, yeah.
Like I'll be getting sick when I didn't expect it to be sick. And they'll be there to talk it to me through it. And I'm able to express that with them freely.
Wow, that's good. So, are they kind of teaching you ways to deal with your emotions better?
Yes, journaling is one of the ways. So writing
Journaling.
it down.
Okay, so tell me how journaling has helped you.
Sometimes there are things you don't want to say
Oh,
because
yeah.
you think it's going to hurt someone or you're just too scared to say it. Journaling helps with that. It makes you process that emotion way better. And then it helps you be able to physically say it.
So, do you allow them to read your journal, or you just look at it and then you say things to them? How does it work?
I keep two.
Oh, you keep two
I
journals.
keep two. I write if I'm feeling angry, then I'll write it in a separate one. But if I'm feeling sad or depressed, then in a different one.
So, how do they manage to help you when you feel sad and depressed?
As my dad says, it's better to think about it positively. So that's how we've been going through everything.
Good. So, do you find that you're more independent now that they're showing you how to deal with your emotions?
Yes, I'm able to go to my appointments alone. I'm able to schedule for my medications and stuff.
That's great. So you shared with me that you don't go to the hospital as much, so that's good, right? What would you say about your quality of life? Has it has it gotten better for you? How are you living now?
It's getting better. I'm able to go out more. I'm not as tired, so I'm not always on the bed.
Oh
I'm
yeah,
able to have fun with my younger siblings and joke around.
that's great. More a normal life, yeah.
Yes.
That's awesome. So, Jenica, now that you have had the benefit of palliative care for several years now, what would you say to the community on how palliative care has made a difference to you being young? Because I think a lot of people think it's only for old people. But what would you say now that you know?
Mm, Kupu Care will help anyone with autoimmune disease. It can help teach them how to be independent and not be scared because they're not in control all the time. So it'll help them process their illness. It'll help them take that little control that they want.
That is a big one. Just gaining control again, yeah? Yeah. So for anybody that might be sitting on the fence on, oh, I don't know if I should call and get help, what would you say to them?
Do call. They'll help you a lot. You're going to be able to do more than you thought you could do.
Just like that leap of faith in the hospital room when you spoke to the case worker and you said, okay, I want that. Even when your mom wasn't so sure yet, yeah? You really took a leap of faith.
Yes.
And are you happy that you did that?
Yes, they've helped me a lot.
Awesome. So, when people are dealing with a serious illness, oftentimes they can feel alone. I don't know if that's happened to you, but how has the support of your palliative care team made a difference for you in that area?
They make you feel at home. It's like you're talking to a friend.
Oh, yeah.
It's not like you're in the office and they're just taking notes of how you're doing and what you should do. They actually get down and gritty. They ask you why you're feeling that way, and if there's anything they can do, they offer support.
That's good. Do you folks ever talk about your future plans, where they're kind of helping you, look ahead?
Oh yes, they always ask me if I'm planning to go to college and what I want to major in,
Yeah.
which is good because it makes you have a goal or look forward to something. So it keeps you motivated.
Wow. So that has made a big difference for you. So do you plan to go to college?
Yes, I want to go back to school.
That's so great. And do you feel that it's been the support of your palliative care team to just cheer you forward? Wow, okay. Do you feel that if you didn't have a palliative care team that comes to visit you at home, would you share any of these things with, your physician in the office?
No, they're more focused on their specific area. And with autoimmune disease, you have multiple specialists. So with Kupu Care, it kind of brings all of those doctors together. So you don't have to be all over the place.
Wow, that's a really good point. So in palliative care, the team coordinates your care?
Yeah.
Wow. So how many different doctors, you know, would you normally go and see?
Like 4 or 5.
Wow. So that must be difficult for your dad too to just shuttle you all around the place, right? Okay. So your palliative care team, they would coordinate all of those appointments for you? Wow. And has that made a big difference for you and your dad?
Yes.
Oh, that's great. That's something that you didn't have before they came. That's wonderful. Tell me now, is there anything else that you'd like to say about your health journey with palliative care? Is there anything that you want to share with us that we haven't touched on already?
It's hard. It's scary.
Oh, yeah.
But they're there and they help you walk through it like one step at a time.
What an honor it's been to hear Jenica's story. She's not just living with lupus and kidney disease, but also living with incredible intention. Her story is one of challenge, yes, but more than that, it's one of insight, hope, and growth. Hearing her speak about her daily realities, the dialysis sessions, the joint pain, the missed events, put so much into perspective. But what really stayed with me is how Jenica lights up when she talks about her palliative care team. Because for her, and for so many others, palliative care isn't about giving up. It's about showing up. Let's pause and talk about that. There's a common misunderstanding out there that palliative care is only for people at the very end of life. But in truth, it's something very different. It's a form of medical support designed to improve the quality of life for anyone facing a serious illness. That could be cancer, heart disease, chronic conditions like lupus, or really any situation where the physical and emotional toll of illness is heavy. For Jenica, palliative care came into her life not just with medication plans, but with people who showed up, who sat with her, who asked her about her goals, not just medical goals, but personal goals, like journaling more, managing emotions, and even planning for college. Her team helps her keep track of appointments, sort out confusing medical information, and process the emotional weight of it all. They even work closely with her dad, her caregiver, so he feels confident and supported too. That's what palliative care really is. It's coordination, it's compassion, it's having someone in your corner when the system feels overwhelming. It's giving you back a sense of control, even when your body feels unpredictable. And Jenica's story shows us that you don't have to be old or dying to benefit from it. You just have to be human and in need of a little more care. Jenica took a leap of faith the day she said yes to palliative care, and it changed the course of her life. She's laughing more, living more, and looking toward the future again. That's not just healthcare, that's healing. If someone you love is facing a serious illness, young or old, consider exploring what palliative care might offer them. As Jenica said, don't be scared to ask for help. You might just do more than you thought you could. Here are a few takeaways from today's topic. No one wants to live with chronic pain. Without a palliative care team, patients could suffer from unmanaged pain, nausea, fatigue, anxiety, shortness of breath, and depression for days, weeks, months, if not years. Having a palliative care team in your corner will dramatically improve you and your family's quality of life. Get needed support for families and caregivers. Serious illness affects the entire family, not just the patient. Without a palliative care team to advocate, families won't receive guidance, emotional support, and assistance in making medical decisions, which directly affects caregiver burnout and a patient's quality of care. Seeking palliative care and having your own team to advocate leads to better health, improved emotional well-being, and stronger family support, ensuring that patients and their loved ones have the best possible quality of life throughout their entire journey. To summarize, No one wants to live with chronic pain. Get the needed support for your families and caregivers. Seek palliative care, and having your own team on your side will lead to better outcomes, improved emotional well-being, and stronger family support. So let's talk about who qualifies. For those diagnosed with cancer, congestive heart failure, advanced renal, kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care is covered under most insurance plans, including MedQuest. You may be responsible for a co-payment based on the type of insurance you have, similar to an amount you pay when visiting a specialist. How does one know they need palliative care? Are you or your loved one experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, and/or depression? Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Mahalo for tuning in to Let's Talk Healthcare Hawaii. Today we highlighted the important benefits of having a palliative care team to advocate for you. Without a palliative care team to support you, you could suffer unnecessarily, making daily life difficult, taking costly trips to the hospital, and reducing your quality of life. If you would like to receive palliative care, please ask your primary care physician to sign you up as soon as you can. By understanding palliative care now, you and your loved ones can make informed choices that lead to greater comfort, peace of mind, and meaningful time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on Naleo TV Channel 54, with a new episode airing every 2 months. You can also view this on our Hawaii Care Choices YouTube channel and naleo.tv. Mahalo to our ohana and friends who wish to listen to the audio version of this program by going to our website, clicking on events, then choosing the episode you wish to hear. For more information on this episode or to send a comment or question regarding palliative care, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733. I'm your host, Lani Weigert, sending you much aloha and compassion. Until we meet again on Let's Talk Healthcare Hawaii, aloha, a hui hou.
Mahalo to Hui Pohala and MedQuest. Hawaii Care Choices, Brenda S. Ho, CEO. And special guest Jenica Xavier,